What is the vaccination schedule for COPD patients? If you or someone you care about has chronic obstructive pulmonary disease, you might be wondering about the best way to stay healthy and avoid complications. One key aspect of managing this condition is keeping up with vaccinations. Let's break down the vaccination schedule specifically for patients with chronic obstructive pulmonary disease. First on the list is the annual influenza vaccine. It is highly recommended for all individuals with chronic obstructive pulmonary disease. This vaccine helps protect against the flu, which can lead to serious complications and worsen respiratory symptoms. Getting vaccinated before flu season can make a big difference in your health. Next, we have the COVID-19 vaccine. It is essential for patients with chronic obstructive pulmonary disease to receive this vaccine according to the current guidelines. This includes both the initial series and any booster doses that may be recommended. COVID-19 can pose a significant risk to those with lung diseases, so staying up to date with this vaccine is very important. Another critical vaccine is the pneumococcal vaccine. Pneumococcal infections can lead to pneumonia, which can severely impact individuals with chronic obstructive pulmonary disease. The recommended schedule usually includes one dose of the pneumococcal conjugate vaccine, known as PCV20, or one dose of PCV15 followed by a dose of the pneumococcal polysaccharide vaccine, known as PPSV23, at least 8 weeks later. This combination helps protect against various strains of pneumococcal bacteria. For older patients, especially those aged 60 years or older, the Respiratory Syncytial Virus vaccine is also recommended. Respiratory Syncytial Virus can cause serious respiratory infections and can worsen symptoms in those with chronic obstructive pulmonary disease. It is important to keep vaccinations up to date as part of routine management of chronic obstructive pulmonary disease. This helps reduce the risk of respiratory infections and hospitalizations. The timing and choice of vaccines may vary based on age, previous vaccination history, and individual health status. Therefore, it is always best to consult with a healthcare provider to confirm the appropriate vaccines and schedule tailored to your needs. In summary, the vaccination schedule for patients with chronic obstructive pulmonary disease includes the annual influenza vaccine, COVID-19 vaccines, pneumococcal vaccines, and the respiratory syncytial virus vaccine for older adults. Staying on top of these vaccinations can help prevent infections that may trigger exacerbations and improve overall respiratory health.